Okay, I have a weird question for everybody here. Have you ever tried to unravel a bowl of spaghetti? As you can imagine, it would be pretty difficult. Now imagine the thoughts in your brain as that bowl of spaghetti, with the beginning and end of each thought representative of the ends of the piece of spaghetti. Now, trying to unravel that piece of spaghetti would take some time, effort, and patience. And this is representative of the thought process of many people with ADHD. According to the National Institute of Mental Health, 4.4% of adults ages 18 to 44 are currently diagnosed with ADHD. As someone who's part of that 4.4%, I've been living with ADHD for about 24 years, since I was 7 years old. I would like to help you gain an understanding and get a better idea of what ADHD is, what it is not, and some of the things we do on a daily basis to cope. First, I will talk about what ADHD is. Second, I will talk about how you get diagnosed for ADHD. And third, I will talk about the things that I do and other people with ADHD do to cope on a daily basis. To begin my speech, I will discuss what ADHD is. According to the National Institute of Mental Health, in general terms, ADHD is a neurological disorder that is highlighted by a consistent pattern of inattentiveness and or hyperactivity or impulsiveness that interferes with daily life or development. There are 3 types of ADHD as described by hopkinsmedicine.org, John Hopkins Medicine website. There's ADHD impulsive and hyperactive type. That is the least common type of ADHD. This is characterized by hyperactive and impulsive behaviors without the inattention and distractibility. Second is the inattentive, distractible type, characterized predominantly by inattention and distractibility without hyperactivity. And third kind is ADHD combined. This is the most common type of ADHD. It is characterized by impulsive and hyperactive behaviors, as well as inattention and distractibility. Moving on, I will discuss the process people suspected of having ADHD go through to get officially diagnosed to receive treatment for the disorder. The process of getting diagnosed may be different today than when I was diagnosed at 7, but according to Attitude Mag, it's a website that caters to people with ADHD. Most of the time, the journey of getting diagnosed starts with your general care doctor. He asks you some questions, puts you through some surveys, and at that point, he determines if you have enough of the criteria, the symptoms, to be referred to a specialist. In most cases, that ends up being a psychiatrist. For children, they follow what's in the DSM-5, or the Diagnostic and Statistical Manual of Mental Health Disorders, the 5th edition. For adults, it's generally just a clinical interview, as many of the things in the DSM-5 do not relate to adults, and it is different from person to person. Once the specialist determines if you possess enough of the symptoms and the test results determine you have ADHD, the next step is to figure out how you're going to treat the ADHD and manage the symptoms, in which that's what I'll talk about next. After diagnostic testing, you will go over the results of your evaluation with your specialist to determine your best options for treatment. Everyone's diagnosis will not be the same, and so the way everyone will deal with it will be differently. In my personal case, I cope by setting routines, making lists, getting accommodations in my classes, medication, and quarterly appointments with the psychiatrist. Some cases may require you to work with the specialist more often. It depends on the severity of the symptoms. Personally, using planners, lists, timers, and making conscious efforts to focus my methods to focus is my method to coping, and that has worked well for me. The most important thing is consistency and structure with whatever methods you are using to cope. There are many different ways to diagnose and treat the symptoms of ADHD, and it is all dependent on the specialist's preferences, your preferences, and somewhere in between. Hopefully, the information in my speech can be useful to you or someone you know to gain a better understanding of what ADHD is and how to deal with it. And finally, everybody's case is different, and the most important is to find out what works for you. Please do yourself a favor and seek help if you think you suspect yourself of having the symptoms of ADHD. It will help you see life in a clearer, more focused way, and it will even help you unravel that bowl of spaghetti I mentioned earlier. Thank you for listening.